Okay, welcome to What the Healthcare Podcast, a platform designed to educate you, the listeners, by hearing experiences and stories from healthcare professionals and patients who have been injured by the system. Today, I am blessed to have Nicole. She is a holistic wellness nurse. And before we start, I'd like to share a couple of her TikTok videos.
We're going to let the baby pick it. But look, we got strawberry. We got a strawberry. Two. I am autistic. And I would like this video to serve as my official diagnosis because I have decided that I am okay with self-diagnosis. If you're looking for a new personal trainer, I highly suggest an 18-month-old because they just want to walk on a stroller all day long. 75-day holistic reset starts Monday. I assume that if you worked in healthcare and made it through 2020 and 2021 and on without realizing the system is so fucked, that obviously, it's not your time to wake up, right? I have a friend, and she's going through her awakening right now. And she's in healthcare, and I'm just I've never seen it happen in real life. I went through mine alone, and with the help of social media, thank gosh.
Okay, so Nicole, to get us started, can you tell me a little bit about your background? What got you into healthcare and what got you out of healthcare?
So quick background, I went to college for a totally different degree in the early 2000s. I dropped out of my last semester, and then that was around 2008. Started trying to figure out what am I going to do with my life, and realized I wanted something that I thought I could do anywhere and be of service. So I started doing my nursing prereqs and became a nurse in 2015. So it took me a little while. So I started working at a level 1 trauma center in 2015 on a level 1 step down trauma unit. And then that's where I was until COVID. I did take a short stint and did labor and delivery for a year in there, I didn't realize at the time that I was not liking healthcare already. So I was trying to shake it up a little bit. But then I went back to the trauma unit, and that's where I ended up until COVID.
So when you say you had already kind of experienced not liking healthcare, what was it about that at that time?
At that time, so when I started, right when I started working, they switched from paper charting to Epic. Everything was this huge turnover. So I was thinking, every day was fight or flight, trauma. I'm staying there, I'm working an 8-hour shift and I'm there for 10, 12 hours. And I just kept thinking, you're a new nurse, you're just learning, it's epic, it's this switchover, everything's up in the air. I just kept punting the ball down the road thinking okay, this isn't nursing, this is just this situation. And then after a couple of years, I started to realize okay, wait a second, the staffing situation, the way that they're handling patients, all of this isn't necessarily a problem with what's going on now. It's an always issue. So it took me a couple years to realize that these problems that I'm having are not just beginner nurse
specific to that
things.
Situation.
Yeah.
So you think that's kind of what started the demise is going over to electronic records, or?
I don't know about that. I think that was
not for you, but the system whole. Yeah.
I definitely don't think it helps for sure. I think that having these algorithms, and that's just a whole conversation. I feel I could talk forever about computer charting and the algorithms and the way Epic works is, you're getting screenings for all these different things that are not relevant to what you're dealing with. You're having to do all this stuff in a certain time frame that you can't realistically do all of this stuff on a computer and care for the patients at the same time and
Correct.
Do everything correctly. I definitely think, like I said, I only had maybe less than a year before they switched to the electronic charting. So I don't really know how that was before.
Yeah.
I was kind of there at the switchover.
So after you left, what prompted you? Had you already been on social media, or were you prompted to?
So I was on social media. So I started working in 2015. Around 2018 is when I was I don't know if this is something I'm going to be able to do forever. And I kind of got into that MLM, thing. So I was already doing kind of social media on Instagram, trying to kind of build this presence. And then TikTok started taking off. That was 2019. So I joined TikTok December of 2019, I think. I was just participating. I wasn't making any TikToks or anything like that. And then when things started happening in 2020 and all that, and I'm seeing all this stuff, and having my awakening experience, I just really understand the TikTok algorithm compared to like all these other social medias. So I did have, that was my plan kind of, is like, I think that there's some way I can make this financially help me in some way, that like this might be my way out of this situation. So I did like know what I was doing when I made, these TikToks trying to put my story out there, because I did know that that was going to be something that people want to support. And yeah, I definitely had that.
I need to know about.
Yeah. Oh, absolutely. Yeah.
So when you post some of those videos where you're kind of calling out the healthcare system and telling your story specifically about the vax, do you meet opposition?
Oh yeah. In the beginning.
Do you see it from like other nurses?
Oh, the worst are other nurses. Right? Yeah. In the very beginning, there was a couple of like the big name, I think they were like Team Halo, whatever, there was like big name nurse accounts. One of them reshared or reposted one of my videos, stitched it, I don't remember what they did, and just like tore me apart. And the comments were just like, it was one of my very first videos, and I was like, okay, this, I knew, luckily at that point I'd already done the work that I knew that I was going to get that kind of stuff. So I just blocked all those accounts. I don't pay attention to any of the negative stuff.
That's smart.
I just can't let that bring.
No, you can't.
But I did. Smart. Yeah, there was a lot of opposition. Okay. Because my biggest thing was bodily autonomy. And when I started talking about that, like, people just go up in arms and they just don't.
Isn't that wild, though?
That's so crazy.
Like, it upsets so many people, and especially other
especially
nurses.
That's what I just don't. It's so frustrating, because I'm like, I don't understand how we can all be working in these same conditions and have such different views of it. But I also know how long it took me to notice it, too. It's like I have empathy and compassion. I do remember what it's like to be on the other side where you're not seeing it.
So what do you think then was like your awakening moment? What kind of snapped you out of it?
Definitely it started with the masks. In the very beginning, it says 2 weeks to stop the spread. And, you're seeing all this. I was seeing all this stuff from Italy on social media, and I thought, this is going to be insane. I was literally preparing my husband. I told him, like, I'm thinking I might need to get like a hotel or something. Like, I'm not coming home. I was just thinking it was going to be this crazy, like, end of the world scenario where it was like a war zone. That's what they were like portraying, right? So then we started having issues trying to get PPE and stuff, and they started changing the safety OSHA guidelines for the mask. And every time you would go in, there'd be like a different rule about these freaking masks. And now all of a sudden you can wear it in you have it in a paper bag for 5 days, but we're wearing the same mask and going into every other patient's room.
N95s.
Yeah, N95s. Whereas before you couldn't use those more than one time. And if you did, you got in trouble. Where are all those people that all these strict infection guidelines, now all of a sudden that's out the window?
And now we're putting them in baggies to be taken to sterilize. And
they weren't doing it as this is because we only have this supply. It was like, well, these are now the safe guys. They were fixing it to cover their own ass and throwing us under the bus by whatever rule. And every time you go to work, there's a new rule about what you can or can't do. So the thing constantly shifting. And then at the same time as all that, there's no patients. They canceled all the electives at my hospital. Everything elective was canceled. People were in fear, so they weren't coming in for those like non-emergency things that we tell people not to go to the emergency room. And the hospital's empty. And I'm like, I'm getting told this, hysterical story on the news. I'm picturing this like, insane situation, and I can't even work because I was per diem at the time. I can't even get shifts because there's no patients. And these two stories aren't lining up. So then I'm like, okay, well, that's where I started doing, the more deep dives into what I'm being told in the news and what I'm being told on social media and all that stuff. Like, this isn't matching. And I understand people are going to say too that the different areas and all that, every hospital is not going to have the same situation. I get that, but there was enough that I'm like, okay, this is something's weird here. And that's when I started taking the courses, trying to do the holistic thing and kind of getting myself prepared, because I was just like already up until then seeing these things I don't like. And now I feel like I'm being in this thing that I don't want to participate in. And, how can I get my ducks in a row to like get out of this situation? And then on top of that, now in 2021 comes in, and now you have the mandates and offering money for, coercion beforehand. They offered full-time employees. They basically sent an email out that was like, we're going to mandate this at some point. It's going to come from some level. There's going to be a mandate. If you get it now we're giving out these bonuses of $750 for full-time employees. So they basically were like, well, look, 99% of our employees wanted to get the vaccine before we even mandated it. Well, of course they did. You didn't mention that you paid them to do it.
Mm-hmm.
And that's when I was really like, okay, this is like insane.
Do you feel like there was others around you? Like, first of all, I want to tell you, your story sounds very familiar. Like same thing. And I was in a hospital in New York. And it was, we weren't in the city, but we were a diversion hospital. We were, setting things up to prepare for this mass overload of patients. And I can remember looking at the TV screen and seeing what, you're saying, that the bodies piling up and
refrigerator trucks.
Yeah. And I'm looking at it and I'm looking around me. I'm like, and everybody's like panicking. And I'm like, are you guys not seeing what I'm seeing? Like, was there other people around you that you could connect with, or do you feel like you were the lone survivor there?
There was not much. There was a Facebook group for employees who were like not wanting to get the vaccine and were trying to figure out, we were trying to talk to the CEO. We had all these different things. Like, I personally was willing to wear the mask. I was willing to test all those things to go. And I'm like, it's not making sense, but they didn't want to give us any leeway. There was nothing. So I think it was about 500 employees out of 10,000 at the time that were like in this group doing doing like religious exemptions and things like that. But on my unit, I'm the only person that actually like went all the way through and got fired. There were a couple people that I know that did end up getting approvals, for exemptions. But there was very few people that even, everybody was just like, well, they're going to force us to get it anyway. Might as well get it. And I'm like, but like, they're only going to force us because everybody's doing that. Like,
right.
If everybody stood together and said, hey, I don't really want to take this. And then at the time, I'm like seeing in real time people having issues after taking it. Like, there's literally a girl wearing a Holter monitor, like shortly after getting it. She had never had issues before, and all of a sudden she's getting like a 24-hour cardiac monitor. I'm like, how am I the only one seeing like the possibility?
Yeah.
And that makes you feel crazy.
Oh my gosh, it does. And I know, like, we talked a little bit when we had our initial phone conversation, where it's like, you come out and you're like, up is down, right is wrong. You feel guilty because you feel like, I think actually you did a TikTok that I saw the other night on this, that you feel that you've been complicit. And yeah, and you feel guilty for that, even though you thought the whole time you were there.
I was just doing what I was taught and doing what I thought was helping people. And I really, actually, labor and delivery is what really woke me up to that part of it, of feeling complicit. It's like, these people, I don't feel comfortable with the way that they're doing certain things here, and I cannot participate in that. I don't feel good about that. And then to go back and apply that to the other units I'd worked on and seen, I'm like, okay, now I have like this different lens, kind of. That was interesting to me.
I bet.
Labor and delivery is very natural. You know what that is supposed to look like. So when you're seeing these situations where you're like, what are we doing? Like,
we're rushing things. We're making decisions from a financial perspective. Doctor's time. It's pretty crazy.
That was rough.
So back to the vax for a second. I feel like the majority of us are firm believers. At that time, we were firm believers of the system and getting our injections. I look back at some of my old Facebook posts where I'm like, get your flu shot. You're crazy if you don't get it. Like, what stood out for you on this injection?
So I was not fully, I still wouldn't say I'm like anti-vax. I was not full, I had reservations at that time for children specifically, but there was a couple, like, I had to get my flu shot every year. They had our previous rules up until COVID was, if you didn't get the flu shot, you had to wear a mask for the entire flu season. And that was not something I wanted to do, obviously. Yeah. So I'm like, whatever, I'll get the shot. But I already did have concerns up until that point. I had already done a little bit of research as like to people's stories and the different, VAERS and all that stuff. So I was already kind of questioning, and then just seeing how everything went so fast. And it's like, okay, well, you've been supposedly testing this for 20 years or whatever, but why haven't we used it on anything else? And now all of a sudden you're telling me it's ready in 9 months or whatever it was, and safe for everyone, pregnant people, whatever. Like, things weren't adding up. And I'm like, I feel like a guinea pig.
Exactly. It's exactly what we were. And I don't know, I haven't done enough research on where that was, if at all, in a clinical trial phase, and why push it? I mean, I don't know. I'm sure you've been down rabbit holes, right?
I've gone down a lot. I tried not. It's been a while. I
Yeah.
honestly tried not to focus on it because there's only so many things that I can control personally, right?
Yep.
I just can't spend that time. I have other things I need to spend that time doing. So I
Yes.
definitely have kind of like eased off on some of the deep holes. But yeah, I was already questioning. I definitely think that it just doesn't make sense to me that there's no they want to say there's no possible side effects and no possible issues.
We had no idea.
Okay, well, none of these stories are, and that I understand everybody wants to talk about anecdotal evidence versus peer review and all that stuff. It's like you have to take the stories into account. You can't just, oh, well, it doesn't matter because it's not evidence. Like, you have to listen to people and their experiences.
Correct. I think that they look at it from a risk versus injury type standpoint. It's like, well, if I give 500 vaccines and only one person dies, it's safe and effective,
Right,
so
right.
Although we didn't even have that to back us up, like we just didn't.
Like
yeah, there was nothing. That was a wild time.
It was crazy to see it happen.
So I saw another TikTok you did that your hospital they did the bonuses, and then they fired people, and then they got, I don't know if they got grant money or something.
They got,
to
so I was looking
more in
retention bonuses to hire nurses. Yeah, that was just so crazy to me. Up until I got fired, they were offering like $100 hour bonus pay to show up. They were that short staffed with me. You know what I mean? Like I'm a per diem employee working 60, 70 hours a week up until, because I knew, I'm like, all right, I'm just going to work all this money. I'm like, I'm going to save up, I'm going to work and, stash this money so that when I get fired, I have backup money. But they were so understaffed already. The whole entire time I worked there, I didn't feel that the staffing was appropriate. And I'm like, even just one nurse, even just me, is going to make an impact. And, so you fire people because they don't want to follow this mandate. And now all of a sudden, 2 weeks later, you have nurses working positive for COVID, but you're firing me when I could prove that I'm negative because I'm willing to test every week. Like, it just didn't line up. It didn't make sense.
It changed rather
changed
quickly.
So fast. Yeah. I forget what question you asked me. I'm sorry.
No, you're good. I was asking, you were getting into it, that your hospital fired people.
Yeah,
and
so they fired.
They were given money, right? Grant
then
money
they got
or
money,
some sort of
yes,
incentive.
They got a couple $1 million for nurse retention bonuses. And then after that, I went back and tried to figure out how much they were given for just like COVID money, whatever. That was like $42 million or something for my hospital. And they have like an extreme network.
Crazy.
Yeah. So that it doesn't make sense. You're
So when you think about that, like, and I get you with the whole rabbit hole, like I went down a ton of them, I got lost in them, and I had to do the same. Like I had to be like, I can't do this anymore. It's overwhelming, and I can't. And then you start questioning everything, and you feel crazy again. So,
yep.
But one thing I do think about is that they fired people. A bunch of us left because we just, kind of woke up.
There was
I
many
guess.
of that too. Yeah.
Yeah. Like, was it an agenda to get rid of old nurses and bring new in? And why?
I personally feel like it's to get rid of the ones that will stand up for autonomy and things like that. You know what I mean? Look how easy it is. You just cleared out anybody that's going to question your narrative.
Yeah.
You just got out so easily.
I agree.
It's really hard. It is really hard to figure out motives for different things and really know. Because like you said, it feels crazy, but like how much of it is connected and runs,
Yeah. Follow the money, I guess.
Follow the money. That's exactly it. Doesn't follow the money.
And what happened to like, what happened to the flu, first of all,
yeah.
And then what happened to universal precautions? And, like our hospital did the same thing. If you didn't want the flu shot, which I got mine, you didn't get the flu shot, you wore a mask the whole time. Why was that not an option for this COVID? Like I don't know. I guess we'll never understand all of it and what their true agenda was, but, I feel like there's a little more to it. I feel like there was a reason we were all
definitely, yeah.
shootout.
There was definitely more to it for sure. And I almost wonder. I thought about this before we got on. I was a per diem employee. I wonder if they only had so many exemptions that they were like allowed to give, that they, didn't accept mine because they could only accept so many, or, out of a percentage. I'm curious. I don't know for sure. I
Oh,
also,
so others did, but yours didn't get accepted.
there was like out of like 500, only 30 got fired, I think. So very
Oh,
few.
wow.
But the thing is that I'm not Christian, and I did not say that I was Christian. I very easily could have lied and said what the
Mm-hmm.
Christians were saying and gotten my religious mandate, but I am an honest person and I'm not going to do that. So I actually took that as trying to be like, I took it to the EEOC because I'm not Christian. I
Mm-hmm.
thought that that was kind of like, religious, can't think of the word I'm looking for there, but
What did
that didn't
they
end up.
say? What did
They
the
said no. I mean, I didn't do good writing. I didn't want to apply for a religious mandate. I didn't think that that was the way out of it. I waited until like the last possible day to fill it out just because I was like, I don't think I should have to declare my religion to anybody to be able to back up the reason why I don't think I need this. But I did fill one out at the last minute, and I just didn't write what I should have wrote. It wasn't the best, it didn't go. So that didn't end up helping me at all with EEOC. But I did end up getting unemployment because of that.
Oh,
So
that's
that
good.
was good. But yeah, I did not.
And I'm sure they told you you
End
weren't
up
going to get
pursuing
that
it.
unemployment.
Yeah, they told me I wasn't going to get it. Yeah, but I did.
Good for you. Good for
Yeah.
you.
Well,
So, talking about incentives on the COVID side, do you think there is any validity to the claims that hospitals received incentives for COVID diagnoses, vent patients, and COVID deaths?
I do. I think that this is where it gets dicey because so many of these hospital systems and doctors now are under a system, right? So people are like, oh, all these doctors are getting paid off and all that stuff. The doctors aren't the ones getting paid off. The hospital is the one getting the money. Doctors are salary these days. You know what I mean? So all these
Yep.
people are like, yeah, I'm not getting any bonuses to write this vaccine. Well, that's because you're working under a network and all those benefits that would come to you is now going to the network. So you're not seeing it. I do think that there's definitely some monetary things going on there for sure. And I
Mm-hmm.
also think that the treatments probably did not help some of the treatments they
Mm-hmm.
were doing and things like that. So,
And that was wild too. Like they had the specifics. This is what you can use, and you can't use anything else. Like
yep.
that kind of surprised me that doctors didn't stand up. More of them didn't stand up when that.
I think part of that too, it's so hard because everything's connected to money. Think about how many doctors, nurses, everybody's in debt.
Yeah.
And how many are on their second career already? Like so many of the nurses I know were already doing their second career because in the, 2008 and all that stuff, things crashed, they move on to there's nothing you can do when you're healthcare. Everything relies on your job. You have your health insurance, you have your family's health insurance, you have all these student loans. How are you supposed to come out and say that if you're not prepared to lose your job? And I think that's where it came down to. It was like I was in a place where I was capable and able to risk losing my job and walk away. I didn't need the money at the time. I was able
Mm-hmm.
to do that. There's a lot of people that aren't able to do that. So I think that was a lot of it is like, you can't come out. And the people that did
True.
come out were fired. I mean, there was a doctor at our hospital that was like speaking out publicly and she got fired just for speaking out. Like not
I
even, it was before the mandates,
Yeah, I saw recently a group of doctors, and I can't remember what the name of the group is, but they're basically a group of doctors that are striking, and one of them was from my area down here in North Carolina. That during the pandemic, he was an ER doc, and he had voiced his concerns about some of the treatment options that were happening, and it's just some other stuff with patients. Anyway, he got fired.
Yeah.
He got fired. I'm like, that's
It's actually, it was crazy. It's really crazy to see.
It's very crazy to see. And I do guess that I think you're right that a lot of doctors are in such a copious amount of debt that like they're stuck in the system.
Mm-hmm. And I think it's hard, like we said before, it's hard to see it when you're in it. And I think, it's hard because I only have one hospital to compare to, but the way that these doctors are and nurses, everyone overworked, underpaid, working too long, there's just no time. How are you supposed to research any of this stuff when you literally have no time for
Yep.
even the job you have? You like the
True.
minimum free time. Like there's just no time to pay attention to all the different things and do all the research on your own. And you think that you're in this system that is doing good. that's the hardest part, is you have to realize that the system's not good, doing good first before
Yes.
you can pull back and start to like question those things.
Yes.
And I
Yeah,
think
I
that's the
agree.
hard thing.
And I guess we're more on the ground level, you know.
Oh yeah, nurses
We're like the
definitely see it
soldiers,
faster for
right?
sure.
Yeah, we see it faster. So
Yeah,
so that's probably a lot to do with it too. I think a lot of patients in general have lost trust in the healthcare system at this
big
point.
time, big time.
What
And
do
even before
what do you
that,
think? Yes, I would say it was kind of like going,
yeah, like I was already
you know,
talking, I used to wear crystals, like crystal necklaces to work, just so that that would be like your icebreaker. If someone says like, "Oh, I like your crystal," you know that they're into like alternative stuff. So you can
yep.
kind of break the ice with the patients and talk. Which ones you can give other advice. And by the end, I mean, we had every patient had an iPad. I'm like putting frequency music on YouTube for people for their pain. Like I was like already trying to bring in some of these like alternative things into my work at the hospital. You need it.
Yeah, well, it's like, where do patients go from here? I mean,
it's so hard because I honestly think that there could be so much good if these two systems, like the alternative complementary system and the like modern medicine system, could merge. But I just don't think the modern medicine system doesn't want that. They don't want people getting well. And as much as that sucks to say, and it sounds crazy to people who don't see it, it is the truth. They don't want people getting well, because if they did, there's so many things they could do. And the nurses are giving these ideas and they know. You're telling me the CEO doesn't know. I worked there for 6 years, and all these complaints I made about staffing, you're going to tell me this whole time you didn't think staffing was an
you're
issue.
the problem.
Yeah, they know. And that's the thing that really opened my eyes, is like, there's days when you have an extra nurse and they send them home. It's like, okay, wait a second. Like, why can't we have one less patient on this day that we have an extra nurse, because you want to save that $400 or whatever you pay the nurse to be there that day? Like, that just doesn't make sense. Every patient would have a better outcome if there was better staffing, better situation. Like, you have these patients I worked on I said there was a trauma floor, but we had a lot of like chronic pain patients and people that came in with like abscesses and stuff that would be in there for like 6 weeks of IV antibiotics. And with their history of drug use, they can't go to a facility. So we'd have them for 6 weeks or whatever. Okay. Like, you have these patients here for 6 weeks. We could be doing rehab, basically. You could be helping them get off of drugs in this 6-week time. While they're here, every patient could have access to these kinds of things. They don't want to. There's a reason that's not available.
Well, the sicker we are, the more money we make them.
Yeah.
I mean,
so I think the future is, I think it's this like, what is it, concierge medicine they're calling it, or whatever. That concierge, like, no insurance, private pay, and it's just doctors and nurses and people that have walked away from the other system and alternative therapy, just doing their own. I think it's going to be two systems next to each other. I think it's just almost like we're living in different timelines almost.
Yeah.
It's like,
do feel like that.
And they're just on top of each other because there's no mingling at this point.
True. I think if more doctors come out and maybe start private practices like that, or nurses, NPs, I think that's wise. I think that too with insurances. I mean, insurance companies were designed to be used like car insurance. Like, they're not designed to be used how they're currently being used. And the amount of
how people expect them to be used, right?
Correct. And the amount of say they have in your
over the tests that you get and everything.
That's
but
wild.
People don't realize that you can go get those tests that you want out of pocket. There's websites and testing. There's all different ways that you can get this health information without having to go through that medical system. I mean, I'm definitely one of those people that like I would cut insurance right now. My husband's like, we have to have it for safety. But I'm like, I don't want to use that medical system. So I'd rather use my cash, save it up, and, have the type of medical care that I want and just pay for that out of pocket.
Yeah, I'm
else.
with you on that.
And I think that it's so hard because being in this like I feel like I'm in this little bubble on TikTok where I am surrounded by other holistic practitioners and doctors and nurses who have stepped away, that it feels like that's the norm almost. And then, you come back and you see what's happening in the real world and you're like, okay, wait a second. There's still a lot of people that are going to want this. And it's just the beginning of this stuff being available. So I do think that it is going to start getting easier for people to access some of the alternative stuff.
I hope
Hopefully.
so. I think the education around it is probably one of the bigger barriers too. I mean, for myself, I mean, I felt like an idiot coming out of healthcare and like learning more about nutrition and,
Oh my gosh.
getting out of my body what I putting into my body and getting that out of it, whether it's a bunch of sugar or like healthy foods, like, and I felt so stupid. So I can imagine, I see where that blind trust comes
Absolutely.
from.
Even just like your stress levels and
Yes.
the, fight or flight, like that was it's like in my one holistic nursing book, it talks about even just like the call bells and the telemetry monitors,
Constant
like
state of fight or flight.
Yes. And the sound, it's higher than like the recommended decibels that's safe for our ears and things like that. So you're literally putting the nurses and the patients through more pain, more suffering, more trauma just in our own environment. Like, if you can't care for the nurses and the nurses can't care for themselves, like how are we supposed to care for other people?
Well,
it's just like this big
correct.
sick system of people that are like hanging on by a thread, I feel like.
thread.
And you don't see it until you're out of it and can heal. I mean, it's crazy, like the amount of stuff that have like healed with my body since like not being in that system anymore.
Same. I think I came out on like 6, 7, or 8 prescription medications and just as many diagnoses, and went through that healing journey and did some spiritual healing, and looked into the holistic route, started some supplements. I have gotten off everything. My health, I mean, it's done a 180.
And then you start to hear the testimonies of just like other people that have healed things, and it's just like, okay, you start to see it happening and then feel it for yourself, and you're like, oh, okay, like this makes sense.
And then you look into the history of healthcare and how Rockefeller, turned it into a business, and then that's like, talk about rabbit hole. But now, and then you start to understand like this is nothing but a business. And I didn't really. It took me moving to the administrative side of the system and working with people who had no clinical backgrounds, but business degrees. So like I felt inferior,
Right.
But I think, and they probably felt the same, not having that clinical experience, but it was like, as I had to make decisions for my department, it was, I'm looking out for the patient first, and then the nurses and the doctors, and their decision-making came purely from a financial perspective. And we should have been able to work together, but we couldn't.
And like these hospital networks are so huge. The one I have 2 in my area that are like competing, dueling, but they've bought up every single thing around here. They're constantly building new hospitals. Like they have money. You have money. So why wouldn't you invest it in your staff and your, making it? I just don't. It doesn't, because
I've never seen such, and maybe this is business. I don't know. I went from healthcare to now I do run a contracting business with my husband, so it's like night and day. But so maybe this is just part of like corporation business. But it feels like nurses in particular are so disposable.
Oh yeah.
And I don't understand that, because if you're taking them away, you're having to bring in new. You're having to train. Like,
I don't understand I don't understand how it works, to be honest. Like the entire time I worked there, everybody felt that our staffing was not appropriate. And since then, and during that time, they're building all these new units, new hospitals, new things within a 1 hour area or whatever. Where are you pulling these people from to work them? I don't understand where they're getting. Like, you're only getting so many nursing students out every year. Like, and I think hasn't fully happened yet, but I think they are going to start bringing over more people from other countries. And
I think so too.
That kind of thing too.
And maybe it's just that nurses tend to burn out so quick. I don't know. I've never seen a more disposable position in my experience.
Yeah.
And especially with the money. I mean, I'd have a real moral dilemma when I had to hire nurses in particular, and they'd be wanting and deserving of good money, but more money than what my most seasoned nurse was being paid. And I couldn't do it. And so I would go and give raises. I was in a private practice this time. I would go and give raises to all the nurses. I got in big trouble for it. But
well,
the second time I did it, he's like, no more.
That was happening too. You're coming out, and I'm like, how are these brand, you've been here 3, 4, 5, and then there's people that were there obviously longer than me, but on our floor, our turnover rate was so high. I mean, nurses were like not even making it a year before they wanted off that unit, because it was just so
burnout.
Our acuity was just so high. They burn it we had to float a lot. It was a trauma floor. There was a lot of trauma. I feel like we had a
It's
lot
gotta be hard.
of, yeah, it's one of those like, it's like a dysfunctional family system almost, like you're trauma bonded, you know?
Yes.
So we all felt like we loved our job, and there was a lot of that like family feeling. And then you feel guilty if you're not working when they're short staffed. You know, like,
Mm-hmm.
oh, but I'm just home. I'm just off today. Like I can go work for my sisters. You know, you feel like you're
Yeah.
saving the day and all this stuff. Um, I
Why?
lost.
Why are
I'm
we
sorry, I
like
lost
that
my
in
train of
those
thought again.
moments?
But
Like,
I think it's because the type of people that go into medicine already are, you know, I think you're already in. People that want to help people
good
have
people,
probably, yes, they've probably suffered, you know, they've probably had a life where
probably.
they want to turn that around, you know, and
Mm-hmm.
I think that's part of it is like, it's a lot of traumatized, undiagnosed neurodivergent people
Uh-huh.
going, you know, like that's a big thing. I
Half of
think that's
us
like,
are addicted to
I
something
think
to
that's,
cope.
yep, I think
Yep.
that's rampant in the healthcare system. I just think we're all just human. And you
Mm-hmm.
get into this system thinking you're going to help people, and then you get there and it's just like, okay, now we got to do it.
Mm-hmm.
And you just feel guilty if you're not there. And yeah, you burn out. I mean, I burn out for sure.
Mm-hmm.
Big
Yeah.
time.
No, I did too. I switched specialties a few different times,
Mm-hmm.
which is nice about, the system that you can go to different areas, but,
Well, and that they don't
you
teach you
know,
that there's so many different options either. You know, you don't start
uh-huh.
to see that until you look into it. It's like, and you have to get your experience at the hospital basically to get into any of those other things. You know, so it's basically, you know, you're pushing these new nurses into these high trauma, high stress situations and burning them out before they even get their feet in the door. That's the crazy part.
Yes.
Like, give them a few years before you
And
try
they come in
and.
so eager,
Oh,
and
so
then
eager. You just literally you just want to help people.
yeah,
That's
and then the
all you want to
more
do.
seasoned nurses, which I never understood this either, kind of eat their young. Why? Why do they
And
do
then you have
that?
the, you know, and I just feel so bad. You feel bad for the patients because it's not their fault either. And some of them know and they realize that it's not your fault, but it's just like,
Yeah.
you go home every day at the end of the day and you're like, I didn't do the best I could because I couldn't. I didn't have the time to do,
Mm-hmm.
you know, I just felt like I was always failing someone. And it was
You walk
rough.
around
It was
feeling
tough.
guilty all the
Yeah.
time.
Hmm. And
Yeah, I
it doesn't have to be that way. And that's the frustrating thing is like knowing that there's ways that they could improve it and they just don't want to.
correct. Well, yeah, because they're worried about what they're making. I mean, that's it. That's really where all the decisions come from administratively. They don't
Yep.
have the know-withal to consider the patient clinically.
And then they're considering like the dumbest stuff, like, oh, your name's not on the whiteboard. You know, like the things that they actually were taking time coming around, like trying to get us to do or teach. It's like you're wasting your time, you're wasting my time.
Yep,
Like I remember this
valuable.
one time they wanted me to literally walk across the street from the hospital. I can't remember if we had this one unit that had like limited patients. So sometimes there would be one nurse working and like two PCAs or two nurses and one PCA. I feel like I was leaving my patients without a nurse, and they wanted me to walk across the street for 30 minutes to do like they wanted me to basically like do my hand hygiene and introduce myself to the patient who was like the head nursing CEO, whatever. You know, you go in
Mm-hmm.
and basically like do this freaking acting in front of them. I'm like, you're making me act out this stupid scene while I left 6 patients across the street with no nurse to come over here and do this. Like, this is not
Just get
healthcare.
this
Healthcare
done.
is
Check this
just let me
box.
take care of the patients across the street. Like,
Yep.
this doesn't make any sense. You're not actually effectively helping anything. Like, this isn't, it just feels like you're going in circles.
Yes,
And
I
it's
agree.
very frustrating.
And I think too when we have I believe you did a video about this too. You did some good videos.
It's funny. I saw
About
you last night, like going and like
did
lecturing.
I figured you
I'm like,
would,
oh,
yeah.
she's deep in there. And then I haven't watched them all in a long
I
time. And that
was.
was, you know, back in the beginning of TikTok, it was a lot more cringy back then. I'm like, oh gosh, like
No,
some
I
of these
don't think
videos,
so.
I'm
It
like,
took a lot of courage to do that. Like, and believe me, I do the same thing to myself. I look back at like my third video of me sitting in my car and I'm like, hey, I just left the system. And I'm like, oh my
yeah,
God, you put that out there. But it took courage for us to do that, you know? Like
it did.
I experienced the same backlash, mostly from nurses. There was one nurse who has a very large platform that I guess she thought I was copying her content. I had
Oh my God.
never been on social media. I was so naive to it. Aside from Facebook, my daughter had to show me how to post on TikTok. I was just looking to connect with other people. I had just left a 25-year career, a good salary.
Yeah.
I had nothing prepared. I just left, and I was trying to connect with other people. And this nurse, it's like I guess she feels she's the only pediatric nurse that could be disgruntled with the system. I don't know. But I was like, she was making videos, and I had other accounts coming after me. I'm like,
that
I was
is the thing that
so
was hard,
dumbfounded.
The big people sending out not that they're the ones sending them, but like the smaller accounts feeling like they have to tag bigger accounts and show them your video, like, look at this nurse and her opinion. And like, I feel like in the beginning, I was very thought out with my videos on like bodily autonomy and why I thought that this is going to be like a domino falling, and spoiler alert, it did. But those videos were very thought out. And then to have those like turned around and, used against you, it's just like, I just blocked right away.
You wonder if they feel bad at this point. Like now that they've seen everything play out, do they look back at those things? Probably not.
They had to be paid, right? I mean, I think they were. I
suppose a lot of them were. I think
and stuff too. A lot of the big ones.
Yeah,
and the ones that didn't at least got a huge platform and are monetizing in some way. I think people that are going to bring down other people like that, like they're not going to realize it.
Yeah. Well, they hate themselves. That's why they're projecting that on everybody else. And going
that
back,
was the thing at the time though too, is like, okay, if the worst thing you can do is attack my greasy hair in that video, like, right? Yeah, okay, like that just shows that maybe I do have something that I'm saying that's correct, right. Because you can't attack my point, you can only attack other things.
Me,
so yeah,
yes, yeah, no, I experienced it from a couple doctors too, which was like really, I called them out, I called each one of them out. But the nurses I blocked, but the doctors I called out because I'm like. This is not a good look. You could see patients like just left and right. They were no longer trusting the system. They were watching stuff like that. They were, I'm sure because a lot of us left, that opened up some of their eyes. But what I was going to say before, but I think you did a video on this, is that U.S. is like 5% of the world's population, and we consume 50% of the pharmaceuticals. Hello, everybody's mindset is altered in some sort of capacity. I don't care what kind of prescription you take. Like it's going to affect you in some degree.
Yeah. Even, and I go back and forth on I'm one of those people that I know nothing. I will admit that I have no beliefs that I'm like dead set, very few that I'm dead set on. I think that there are times when modern medicine is,
Agreed.
very useful, and I'm sure that there's times we need it. But the fact that like they demonize all these other alternatives and not even realizing like these are other like cultures in information, you like say it's a quackery or, give no validation to any of it. It's like you could be using these alongside the medication. And having the medication work more effectively because you are taking care of other parts of your body, like they just don't understand that can go hand in hand. And then somehow that like the normal person has like adopted that belief, and they're the ones that are like bringing these messages to people and commenting on accounts like this. It's like just some random person that's like, oh my God, I can't believe you don't trust the doctors. Like, how do you even get that? They're just like, it's so ingrained in people to think that everything out there is crazy or different or, it's quackery or not going to work. There's so many things out there that you can do to help.
I agree. And I agree that I think there is a place for prescription medications and there is a place for Western medicine. And at the very least, what this last few years has taught us is that there are other options and that we should just probably be a little bit more cautious about what we do take, and not just, when a doctor is given 15 to 30 minutes max to see a patient, they cannot possibly, it is we're looking at the problem, not the person. And it's not that all, I think doctors catch a lot of flack for that. And there's some not so great doctors in the system. Right. There are, but there are a lot of good ones, but they're pushed into a corner. Like they are not.
That's why I think so many people like, I feel like the message gets twisted, right? Is like some people say, oh, these doctors is like, I would say probably like 80% of the doctors don't even realize that they're trapped in the system either. Like everybody wants to like put the blame into the doctor. Is like, they have to be able to wake up to it too. Like everyone's just doing what they were taught, what they thought was the best thing, by these systems that taught us. And it takes a lot to be able to break out of that train of thought and pursue other things. And a lot of times it's not until you have physical symptoms or your family has physical symptoms that aren't being treated by the medical system that you're like, okay, well, maybe I need to explore some other options.
Correct.
And it just takes you seeing it for yourself to realize it.
Yes.
And
And
I
it's
think,
hard then to watch other people that like love
right.
and care about.
Oh, yeah. I think so. That one's really hard for me. That one's rough.
That's hard.
Something I don't hear talked about enough is the absolute rage and grief that comes along with awareness and watching people you know and people you love being marched to their death in the medical system and not willing to hear what you have to say. Knowing that maybe you can, at the very least, improve their quality of life and at the very most, save their life. And they're not ready for the message. It's infuriating. And it makes me sad that I just have to handle that knowledge.
We talked a little bit too about, I think on our phone call, that, you kind of go through this healing journey after you leave healthcare. What has your journey been like?
Oh my gosh. That would probably have to be a whole another podcast. A lot I've done. So in 2020, when things started to go south, I started realizing, that I had some substance abuse issues that I wanted to work on. I was having a lot of family dysfunction. So I started seeing a psychologist and did some cognitive behavioral therapy. And then once I was out of the hospital, shortly after, I think it was like 2 months after that happened, that I went to Mexico and did like an ayahuasca healing retreat.
I want to do that.
Yeah. Oh my God, it was amazing. It literally changed everything about my life. Me and my husband went for a week, and that was just like so profound. But then from that just like skyrocketed me into like all the other healing modalities, somatic work, yoga, meditation. Like we just learned so much about all of that in that situation. That the last couple of years has really just been a lot of like journaling, meditation, rest. I just was one of those people. I started working as soon as you could get your worker's permit or whatever in high school. I had like multiple jobs in high school. I was just a worker. I've always just constantly worked. It was one of my, and that was one of my, coping mechanisms and trauma and all that good stuff that you learn about eventually. So it's just, I've been in this kind of like rest period. And then during that situation, I've got pregnant, which I at the time had thought I was infertile. So that was like a big unexpected blessing. So that just kind of the last 2 or 3 years has just been resting, healing, growing a human. And now I'm trying to consciously put that into him. It's just so crazy because, he wouldn't be here if I wouldn't have woken up to the way it all happened. And I'm a firm believer that those things happen for reasons. And
absolutely.
That, everything that happened got me to this point. And I'm at the point where I'm, able to see that that's a good place to be. So
that's wonderful.
Yeah.
So when you first came out, you probably experienced all the emotions, the guilt, the anger, the ups, the downs, and then you finally got to the point where you're like, I got stuff I
did. And in the beginning, it was like, okay, I'm going to fight. I came out literally wanting to help, like safe staffing ratios. I was going to go to these like nurse marches and whatever, the Million Nurse March, I think I made a video about shortly after. But like the million nurses were like, we don't want to talk about vaccines at this, they alienated people. And I'm like, okay, why would I go like
support you if you're gonna
support these people and like talk about staffing and I went and I did a statement with, it was the government of PA. I don't remember what Congress or I don't know, but I like spoke to the government in front of the government on a call like this and like talked about staffing and talked about mandates and did all these things. Like I wanted to like share my story and like help the people left in the system. But at a certain point, I'm trying to pursue the legal things with the hospital. I still wanted to like have my rights and know, all that stuff too. And at a certain point, I just had to be like, I need to just like wash my hands of that whole place, of all the people, like I just had to just like be done with it. So I'm sure there's probably more I could have pursued as far as the mandates and getting fired and all that stuff legally, but I just didn't.
You needed to be done.
And I just
you don't want to go back there mentally.
Yep. It was just, I put that part of my life to bed, and I am grateful that I have the medical background that I have and that I was able to get my foundation in nursing and then turn that into something hopefully more useful to people and actually like help. And I do think that like my experience and my story can be used to help people in some way. And it's just trying to figure out how that is going to like
definitely
go forward. But
yeah, Yeah, no, I think it's important that we as healthcare professionals can share our experiences, because I don't really know what the answer is and how to fix this system other than the support and allowance of other modalities, not just Western medicine, not just prescriptions.
Hmm.
But it's got to start at like the curriculum,
That's
med school
that's the problem,
curriculum.
and that's the problem. It's all connected.
Correct.
Everything's and that's what people don't get is like, I don't want to talk about politics. I hate politics, but it's like, okay, like the actual
But they
system,
sure
it's
affect healthcare.
all connected. It's all
Yes,
connected. You have to dismantle the whole freaking
you
thing,
do.
which is why, like, okay, you're either going to dismantle the whole thing and start from scratch,
Mm-hmm.
or like we said earlier, you're going to build alongside, which is why I think right now it's a build alongside until,
Yes,
and
I think that's how it has to be.
for now that's legal. We're allowed to do that, but
Ugh,
they were
I
in
sure hope that
California
doesn't
threatening to take
change.
licenses and stuff like that when you were talking out about things. So,
Yep.
it's just one of those, it might be an underground system at some point. Who knows?
Yeah.
I've been trying to pay attention to like the astrologers and all that. And I do know that there's shakeup coming, but who knows what it's going to look like,
Yeah.
in the next couple of years. So I think it's just kind of trying to hold space for the people that are waking up and coming out of the system,
Mm-hmm.
just being there and, using our stories to at least show people that there's other ways that you can be
Correct. And
helpful
informing. Yep.
outside of the healthcare system,
Yes.
and leading by example. I think that's the biggest thing. And that was a big thing for me too. Is like I was studying the holistic stuff. I
Mm-hmm.
knew a lot of information, but I wasn't using it on myself, and I
Mm-hmm.
wasn't living that lifestyle. And I think that's what these last couple of years has kind of given me the chance to, you know, be the
Focus on
message
that.
that I'm spreading, and to kind of live in that lifestyle and
I like
get
that.
get my feet under me and
Yeah.
hopefully spread it.
It takes years to undo the indoctrination
And that's the
and
big thing too,
you
is that,
know,
you didn't get this way overnight. Things like your health didn't get bad overnight, and trying to like undo everything in a week or 2 weeks or a year,
yes.
takes time, and it goes so fast. Like the fact that it's already 3 years, I'm like
Right.
looking back, I'm like, holy cow. Like it's coming up next week, or 2 weeks is my 3 year like anniversary of leaving.
Oh
Just
wow.
like a totally different lifetime ago, it feels like.
Yeah, I feel like that too. I mean, aside from this podcast, like, and that's why it's taken me so long to get to this podcast, because I would make progress on it and then I'd be like, I would be going back there mentally, and I just didn't want
Hmm.
to.
Yep.
I wanted far away from the healthcare system. I didn't want anything to do with it ever again. So that's what's taking me so long to get here. But it's like, I trademarked it. I've made it this far. I've got to do this. And at the very least, I don't know how we fix the system. I don't know. And I don't know that I want to, I
Participate in
care,
being
but I
one.
don't, yeah,
Right.
I don't know if I want to
Exactly.
participate,
Yep.
because but what I can do is help to spread awareness and
Hmm.
to share, give people a platform, because, like we both experienced when we first posted on social media and kind of got that attack. Well, I mean, I'm sure it set me back, like, so I think having a platform like this
Hmm.
where we can come together and talk about our experiences, and it makes you realize, like, it
That
wasn't
was
just
the
me. I'm not
biggest
alone.
that was a big thing for me too, is like, as much as I did get that attack, so many people came out, to support. And I mean, followers, and I try not to focus on numbers and things like that, but I
Mm-hmm.
mean, followers like shot up overnight. And I just found the people that want to hear the message. And there's still haters, there's still people. I mean, I think I have some blocks on my words so that I don't see some of the comments.
Yeah,
But I don't generally get a ton of hate. I try to not be
that's
super
good.
controversial anymore. But I think that there's just so many good people out there, and it's so cool to just like be able to connect and come together and
Yes,
have this community with people that are around but not in our little networks, 'cause
I agree.
sometimes you look out in the real world and you're like, is there anybody else that thinks like I do? And then I come to this space and I'm like, okay, yes,
Yes,
they're
there's
out
lots.
there. It's just we have to
At
spread
the
the
very
message a
least, it's
little bit.
connected us.
Yeah.
Yeah. Yeah.
I'm very
Okay,
grateful for
so
that.
what's your journey look like now? What's your focus now? What do
So
you
now my prime focus is mom life. That was something I didn't expect when I got out of the hospital. So when I left the hospital, my goal was to get this holistic certification and start my own business. I wanted to do hands-on, either like a course or, one-on-one appointment, something. I wanted to like in some way put my skills to use. And then I got pregnant, and that just like changed everything. And now I very much want to be a present, stay-at-home mom and do that. But I do still think that this has value, and I don't want to just like let that all slide away
Yeah.
either. So I'm primarily just kind of focusing on TikTok. I do TikTok shop. I like to focus on the holistic stuff. So I try to find products that help people. I'm into like the Cali sober thing. So I like to find a lot of non-alcoholic options and things like that. So right now that's my main thing, but I do still think eventually it will become more. My biggest dream or goal right now, I would love to have like a retreat center eventually,
That'd be
and have
awesome.
like a space where people could come. Ideally, I think it would be awesome to have it like where I live and have like a little farm where people can come and just like recover and heal and get my experience with plants and plant medicines and kind of
I love that.
recover in a different way. But that's some way off right now. So
Yeah.
mom life kind of took over, and I'm just right now I'm trying to be in flow state. That's my word of the year, and I'm just trying to kind of see where it goes and
Yeah.
just
Well, that's good because it's
be
probably
present.
the first time you've been able to do that.
Exactly,
You know?
exactly. And I'm just trying to accept that. And sometimes that's hard to be in that space where it's like I don't have to do something to be
Yeah.
valuable. And I'm trying to teach myself that sometimes.
Well, good. I love your videos, your content.
Thank you.
Yeah, you put out a
I'm
lot
so
of good
excited you're
stuff.
doing this podcast someday.
I am
Looking forward
too.
to it.
And I'm so glad that I got you on here and was able to talk to you. I have a couple doctors coming on. I have a couple
Oh,
patients coming on. Yeah. So I'm excited. What I'll do well, we'll wrap up first. So is there anything else that you want to talk about, discuss, go over?
I don't think so.
Promote?
I'm like, no, not right now.
Okay.
Don't have
All right.
anything to promote.
Just thank you for being on, and I really, really appreciate your
Thank you for
time.
having me.
Your story is an important one, and whether whatever direction you go, you still have this knowledge and experience, and that you can
Exactly.
share whenever you want with who you want, or you don't share it at all. That's okay too. It's okay to do whatever you want to do.
Thank you.
Yeah.